Cheers. Thanks very much, Keith. Thanks for your kind words. And what I'm going to do is pick up on quite a lot of what Lars has been talking about in terms of the focus on the NHS partnership. And I think the opportunities tonight will present to us in terms of working together, and to show you an example, a practical example of a health technology challenge in a little bit more detail than Lars had to share with you. And I think it's quite important as well to note that the Health Minister this week has been focusing on adoption and diffusion, and telling us, you know, that we've got to stop doing the things that don't work and think about new ways of doing things. The South East Wales Academic Health Science Partnership is a partnership of 9 organisations, 3 universities and 6 NHS organisations in this part of the world. So it's we're quite blessed in the southeast of Wales to have such a wealth of people and services. And you can see that the 3 health boards that we've got, my own Patchynara, Bevan, Cumtap and Cardiff and Vale, with the 3 universities, University of South Glamorgan, Cardiff Met and Cardiff University. The other partners are National, Velindre, Wales Ambulance Trust and Public Health Wales, which feed into the whole of Wales but all have a base in the southeast. So the partners have come together to form an alliance, really. That's what we are. We operate as a managed network. But I think, as Lars focused on the NHS, the really important bit is that it's an equal partnership. I think in the past it's been quite traditional that the HEI partners would be in there trying to do to the NHS and research in the NHS. Industry is over there and probably nowhere near, but this is about having an equal partnership between the National Health Service, the universities and industry. We're a strong self-funded partnership with a shared mission. So the partners we fund the initiative ourselves, so we own it, it belongs to us. And the South East Wales is also the regional hub of the NISCA AHSC, the Academic Health Science Collaboration. We're focused on health and improving the health and wealth of the population of South East Wales, and our programmes of work include health services and delivery research, industry and health technology. Now, the health services and delivery research is obviously very NHS focused, but there are whole university departments, business schools, social sciences that are all really involved in helping health services to solve some of their problems and to generate the evidence upon which to build practice. The industry group is a big and very engaging group, and the health technology I'll tell you a little bit more about in one of our pieces of work, the Health Technology Challenge. So I think that there are opportunities for us in SEWAHSP to work with Cardiff University as an existing partnership, because you are a partner of SEWAHSP as well. So I think that there are plenty of ways that we can engage with each other. So the aims of SEWAHSP are to share, and I think this is sort of, you know, again, what we've got in common is that we share similar ambitions. Our ambitions, the innovation side of Cardiff University and SEWAHSP's ambition is to improve the health and wealth in Wales, to promote and support innovation and research translation, to develop and sustain the South East's reputation for research excellence. We've got a lot that we can build on here. And also build on this long tradition of excellence in community-based research. And again, going back to what Lars had to say, that a lot of this work is going to happen in the community, in preventing unnecessary admissions into hospital and really sort of trying to develop those services to go away from the traditional ways of caring in secondary care. It's also about, our mission is also about building a knowledgeable and skilled workforce in delivering high-quality research and promoting South East Wales as to attract inward investment, to contribute to economic prosperity, and really to add value and to enhance impacts, because we're already, as individual organisations, working in these fields of innovation, and what can we do together, I think, will be probably better than them, greater than the sum of our individual parts. So the Health Technology Challenge that I did promise to talk to you about. So we have got experience at the sharp end of supporting innovation. Dr. Corinne Squire, because these are some of her slides, who is here this evening if you wanted to talk to her, applied for and got an Intellectual Property Office grant, which was topped up from some other money that we had. And this was to develop an open innovation platform for sourcing solutions to unmet clinical need, much as Lars was showing you. And we created the scheme and an interactive website, and it was launched in June of last year. And it was a two-step process. So the first step at the launch was to invite challenges. And these challenges could be posted on the website. It was quite easy to get into the website. It was open to the partners, to the SEWAHSP and SATRA partners. And clinical staff could go and post their clinical challenge, much as Lars described. This is a problem for me. I need this. I haven't got that. The idea then, the challenge went out into the community, and the community responded by saying, oh, well, I think you need one of these or one of those, or I've got a bit of technology or a kit or whatever that could help you with solve that problem. And comments could be provided, and also votes, so you could click if you liked something. I don't think we had any dislikes, did we, Corinne?
We didn't have any dislikes,
no.
No. Or did we? No, we did actually. We did have a few, but they were, most people were very polite. It also wasn't anonymous, so...
That probably helped, yeah. And then the challenges were selected by a panel, which included SEWAHSP partners and some external members. And the challenges were assessed for their feasibility, because you can have a fantastic idea, but if it isn't particularly feasible, it's not going to go anywhere, and for medical need and for patient benefit and importance. And so we've now selected 4 of those projects, which will be funded up to 25k each, to develop that into the next stage, which will be about developing that product idea, whatever that might be. Now, the applicants had to include 2 SEWAHSP institutions. The pilot project, we think, has progressed really well. We're happy with the way that it's gone. It's generated a lot of interest, and it's proved to be easily adaptable and easy to use. And we're now seeking funding to continue with that initiative, because we sort of feel that we've got the projects gone so far down the line that we're ready to sort of go again. We have learnt some lessons, but generally it's gone really well. So, in terms of the headlines of what we've done, the South East Wales Academic Health Science Partnership was launched in 2012, in October of 2012. And since then, and since to the end of 2013, we've created 9.5 new jobs. The funding between the 9 partners is only £160,000, so I look with envy when I hear Lars tell me quite how much money they've got in their various pots of money. If I was a little bit taller, I'd turn you upside down and shake your pockets out, Lars, and get some of that money. But nevertheless, even with a relatively small amount of investment from the partners, we've already attracted an additional £225,000 internal funding within the partners to do projects. We've had external funding, £250,000 for an NIHR grant to look at knowledge transfer. Now, knowledge transfer is really an important area, and I know Alison's in the audience. Well, try to sell her project as well as I can. But this is about how much, how do senior executive members of health boards and in the NHS trusts, and how do they value and see themselves as enabling the transfer of knowledge into practice and really supporting that, and do they see that's their role? We've had £7,500 for strategic insight partnership bids, and these are small amounts of money, 3 of them, to actually develop research ideas and to write bids and grants. And this is Corinne's £65,000 from the IPO, and the Welsh School of Primary Care, £24,000 to do a pilot project for a much bigger piece of work, which is around the optimisation of patients with cancer in primary care with their GPs to optimise their preparation for surgery for cancer. We've had a CureOps student, which is a summer student, to help with the knowledge transfer work. We've got more bids in preparations, and we held 4 workshops events on a conference last year. So we've been quite busy and out and about. So just to sort of close, really, thinking about some ideas that we've had as a team about how SEWAHSP could support innovation for South East Wales working with you, would be about enabling clinical access into the NHS in Wales through its partners. We've got all the partners in South East Wales are part of SEWAHSP. So there are members, at least one on as part of the board from all of the partners in the NHS that can enable access for you. really to capitalise on existing strong NHS relationships that we've got for accessing not only patients but staff within the NHS, and that's where industry, I think, sometimes struggles. To support the early adoption of innovation into clinical practice, because we are in the NHS and we can be part of that really hard piece of work of when you've got something that works, how do you get it adopted into practice? And we could help to develop the use of open platforms for sourcing innovative solutions and developing innovations and ideas for innovations within what you're Keith, what you're trying to do. And we could provide support for major funding schemes and facilitate innovation workshop events, because it's something that we're doing anyway. So that was just some sort of thoughts off the top of our head, really, as a team in SEWAHSP. So I'll leave you there. Thanks very much.